countries who have covered everyone spend less on healthcare. And we spend far more than them, and we still will spend more than them, but yet we're about to throw millions of people off the insurance rolls.
Mm.
There's something deeply wrong with our healthcare system.
You're watching Chic Innovator. Stay tuned for fascinating topics, fascinating people that have style and are innovative.
Thank you so much for being here on Chic Innovator. So we say fascinating topics, fascinating people that have style and are innovative, and you're all of the above. I have to tell you, it was such a pleasure to meet you. Thank you, Jose Sanchez, who had me MC the event for the Humboldt Park Health Center, and what a great event that was, wasn't it? That was really,
It was fantastic. It was a real feeling of family almost
yeah,
among hundreds of people. It was
yes.
impressive. Yeah.
Yes, it was an elegant gala, but then we also, I think are facing a lot of realities with there that they spoke a little bit about at the event, which was good. And anyway, it was an honor for me to MC it, and it was a big pleasure to meet you. If you'd let us maybe say for us your full name and then the title that you are currently using, because you have had so many impressive titles, I have to tell you. But tell us the one that you're using right now.
Sure. My name is Bruce Siegel. I am the president and CEO of America's Essential Hospitals here in Washington, D.C. And we represent safety net hospitals around the country, including Humboldt Park Health.
Yes. And I know that when I was looking through your resume and then we were talking a little bit, I mean, you represent 350 plus, right?
Yep,
Organizations across the country, which
true.
is huge. And how long have you been in this position, Bruce?
Almost 15 years. So it's been a while. Yeah.
And I hear through the grapevine, unfortunately for the organization, that you are going to be leaving at the end of this year, right?
I am retiring, quote unquote. I'm not sure what that means yet, but we'll see. Yeah.
Yes, but I'm so happy that you're able to share some of your time, but also some of your expertise and knowledge with us before you go, and hopefully even maybe after. That you can stay in touch with us because I think there's so much that people don't know. I think about the healthcare system, and I have to tell you, I have an interest. I served on a hospital board. Uh,
Oh,
Many years ago. I was actually on the Swedish Covenant Hospital Board for 6 years. I am not Swedish. I am of Mexican descent, but they had invited me to be on there, and I learned so much. It was such a great experience to understand the importance of healthcare. I mean, it is 17%, 18%, very large part of our spending in the United States, right, and growing. So I think it's very important for people to understand this because, in many ways, it will impact our pocketbook whether we think it does or not.
oh,
So
absolutely. It's healthcare is the largest industry in our country. You hit the nail on the head, and it's actually been, one of the areas of our economy that's actually been growing and, adding jobs, good jobs. So it's been a bright spot. We'll see if that continues, though.
yes, yes. So tell me a little bit about your background because it seems like you've lived in many different places. And so I was trying to figure out where exactly was your initial home. I think now you're, you know, US, but where were you initially born?
Yeah, so I was born right outside New York City, and we moved around a lot because my dad was an engineer for the military, so a lot of defense work. So we lived in New York, Puerto Rico, California, Kansas. We got lots of places. And my mother, and my parents are both long past, was an immigrant from Haiti.
Oh, okay.
So yeah, she came over when there actually wasn't much immigration, and she came to the United States in 1949. and met my dad, and they got married. And actually, for a while, they went back to Haiti and lived there. So they got around a fair amount.
Okay. Do you think that was helpful for you to be more empathetic with, all the people that basically are able to help now? Did,
I would hope so. I was born in a public hospital in our county. It was, the poor person's hospital. It's still there. And my parents didn't have much money at the time. I mean, they never had much money, but they certainly didn't have it at that time. And so we were grateful. I was grateful for the care that my mother got. I know my parents were. They talked about it. And since then, we've had other relatives from Haiti who have needed care from public hospitals or have been on Medicaid, in-laws who have been on Medicaid. And so I think my family and we value this. We know that it's a great kindness, and it's also a good thing for everybody's welfare to have these sorts of things in place.
so I'm curious because what was instilled in you? Because it sounds you moved around a lot, immigrant family, new country, your mom, right, from in a new country. And so what did your parents, because I always think it goes back a lot to the parents as well, but did they instill in you to get you from there to where you're at now, because you're a medical doctor, you've got a master's in public health, and then you've had all these key positions, that I've mentioned. And what was that inner message? I always find that, parents do things or give these messages either subtly or very directly that are a big part of the success that people have.
There were very clear expectations that you were going to go to school,
Mm-hmm.
you're going to do well or else, um, that you were going to try to make a contribution and better yourself. And so that was always kind of clearly laid out. My family back in Haiti, they've been active in the law and other things, sometimes in politics, which wasn't always pleasant in Haiti for some of my family members. And so there was also like an installation of pride, about the history there, what had happened, the revolution, all those things, which I think, yeah, myself, my brother, my sister, we kind of drank that up,
Hmm.
uh, and sometimes it's probably more than we ever wanted, but yeah, I will say it was a good thing. It was a good thing. Yeah.
No, it sounds good. And I do think that it's important that sometimes, and my parents are immigrants, first generation here too, but understanding the culture that you come from, your roots, if you will, and the struggles that your parents have had, to be able to give you what you currently have. I think it's really important for parents to communicate that too, so that kids don't take that for granted, right? And
Yeah, I worry about that. I have two daughters, and they're wonderful, and they're in grad school now. But I don't know if they've ever felt that. They've never felt, hey. I remember sometimes when we were kids. I mean, we always were okay, but I knew at times there's not much money in the house,
hmm
or
hmm
dad lost his job, or we're gonna have to move because he needs a new job, or that always was sort of sobering. The other thing was number of times, and sometimes for months at a time, I would go back to Haiti with my parents or with my mother. We had a big extended family outside of Port-au-Prince. And I remember one of the things that really struck me was when I was growing up, we would go back to Haiti quite frequently. And sometimes, we would spend months there. Sometimes my mother would, take me. I was the youngest child, and she'd want to hang out for 4 months with the family, in Port-au-Prince. I'd meet a lot of the relatives. I was young, and that was like a different world for a kid from the United States to go to Haiti. And that also was, I got the message that we're pretty lucky. This is like we are privileged in this country. I'm really fortunate that my mother made this trip in 1949, not knowing what was on the other side. And that, also was something that I don't think a lot of our kids today necessarily have experienced and seen.
No, I agree, and I think it's a good thing if parents can show them that. or instill in that. And even if they're born here, I think it's good to travel also because of that. And
Yes.
just to understand there's a whole other world that has it so much worse than we do. That they face tough times. And even frankly, in our own country. There's parts of the country where people are suffering a lot and, they don't have it, the best they can. My daughter, it's interesting with her. I have a 20 something, and I think I shared that with you as well. And as much as tried to instill the culture and share with her, we come from Mexico originally, my mom and my dad. She kind of took it on her own and took on some projects that at the time I'm like, what are you doing? Like Save America or some other projects that you go and you build homes or whatever, right? And I was like, what? Sometimes I get nervous, but her dad, he's like, we've got to trust this. It's good for her in the
Yep.
long run. And so I think it is good for them to suffer a little bit, right? I think it's important for them to
True.
understand, right?
Yeah. Actually, just there's a lot of people who've studied this. No more than me will say that one of the keys to resilience is having been challenged and having failed sometimes,
Yes,
and learn from that and
yes,
realize that you still are alive the day after you fail. And
yes,
the most important thing is, what do you take away from that experience? So,
yes,
yeah.
yes, for sure, for sure. No, so well, thank you for that. So tell me, because in the 15 years that you've been in this position, and prior to that, oh my goodness, you were in New York City, right? You were
Yep.
the head of New York City healthcare system, and then I think it was in Florida as well. Weren't you there as well? So you've
Yes, I ran a big hospital system in Tampa General.
yes, so you've had a vision for healthcare. How have you seen healthcare, let's say in the last 10 years, change in the United States?
The big thing in the last 10, a little more than 10 years was the Affordable Care Act. And it had a dramatic and positive impact. You know,
Okay.
Millions getting health insurance, many people, their financial security being improved because, there was insurance to pay for their bills, and, there wasn't lifetime limits on how much, their insurance would pay, and their kids could stay on their health insurance till the age of 26. I mean, there were a lot of good things in there, in addition to covering millions of people. And I thought we were really heading in a good direction. America never runs in a straight line. We all know that.
Hmm.
But in general, going until this summer, frankly, in a direction towards recognizing healthcare as a right and recognizing that everybody should be in that tent. I mean, we hadn't gotten there yet, but we got more than halfway there, under the Affordable Care Act.
Hmm.
And
I know that a lot of other countries are praised, right, because they have healthcare as a right, and included in there. And I'm sure you've studied other countries and looked at them. Um, and and yet there's the criticism here that why should we do that? Why should we take care of everybody and individuals? Share with us your thoughts on that.
yeah, so I have two feelings about that. One is, healthcare is so important to being a functional and positive part of our society. Many people can't get the job they want, because they don't have their health isn't in a place that allows them to do that. They have chronic diseases. They have behavioral health issues that are so prevalent, especially with the pandemic and the aftermath. That these things, and it's not their fault. These things are challenges to them, to holding that job, finishing school, doing all the things that we want our children to do, eventually, and to pay taxes. And so we shouldn't view healthcare as some expense that, oh, it's a luxury. I don't know if I should give it to this person. It is part of a pathway to wellness and to being a full member of our society. I think that's one of the problems. I know we'll probably talk about this more, because we've kind of flipped it on its head now. What we're saying is, oh, well, if we can't prove that you're working, and we can't verify it, um, we're just going to take away your health care. That's got it backwards. The other reason I think that it's so important to cover everybody, it's kind of interesting. When you look at all the countries who cover everybody in their nation, they spend less on health care than us.
Oh, they do?
All of them.
Okay.
Yeah. I'm talking about all the developed economies, in Europe and the Far East.
Could you name some of them that like the bigger ones?
Japan, Taiwan, South Korea, France, Germany, Spain, England, Canada, all the, those advanced economies. So that's telling you something going on there. And I think in America, we have created this system because it's not inclusive. Instead, the incentive is to, I'm going to specialize in something that makes a lot of money and aim my product at this population.
Mhm.
It's very commercial, you know, um, or I'm going to find a way in which I can increase my billings so I can, cover the costs of care for people who may not have health insurance. So you have all these kind of weird incentives, and so it's maybe it's ironic, but countries who have covered everyone spend less on healthcare, and we spend far more than them, and we still will spend more than them, but yet we're about to throw millions of people off the insurance rolls.
Mm.
There's something deeply wrong with our healthcare system.
No, and I mean that's a huge statement. If they spend less and people are healthier, right? Because people, for the most part, then are healthier in those countries. So the long-term impact, then you have more people that are able to work and to function, right? Because they have the basic health care needs, and in the long run, the country will run better as well in the long run. Which is, if you're looking at it from a perspective of like a CEO, you know, uh, that is here in the United States, how are you going to have a workforce that is healthy if you don't have the basic healthcare needs met? Then you're not going to have that workforce and you're not going to be able to lead. And so if that is taking place in other countries and they're doing it at a less cost, then we should be looking at that. Or we should be emulating that, I would assume.
We should. And, I do think, and this is going to sound terrible, but one of the good things I've seen in my career is that when I started out, people would always tell me, oh, America has the best healthcare in the world. Well, we have the most technology. That's true. We do the most around research, or at least until recently we did. It's been more recently that's in question. But there was the most innovation and the most science and technology and breakthroughs. Nothing else like it. But
And
for the average,
it's still coming out because even with AI, you're still getting like all this data. And I'm in technology, so I see a lot of
absolutely. And I think AI could be a very positive force, by the
yeah.
way, if
Mhm.
it's kept within, if we regulate it, guideline it, just, put some guardrails around it.
Right.
But so we have an incredible system. But when people would tell me it's the best healthcare system in the country, I say no. For the average person in this country, compared to the average person in these other countries, it's not the best. It's hard to get in to see a physician or other practitioner. It's very expensive. I'm not guaranteed health insurance. I mean, I'll admit something. I'm going to be 65 next month. Don't tell anybody.
Okay.
And I've been
When's
working
your birthday? When's your birthday?
sometime next month. I'm not going to say
Okay.
anything.
All right.
I'm not put it out there. Somebody might use it for identity fraud.
Okay.
I'm a Libra. That's all you need to know. Uh,
Okay. Okay.
and I lost my train of thought there. So I'm getting ready for Medicare. I've been in this business for 30 years. I am completely confused because I'd never thought about it from the point of view of somebody's got to like sign up for Medicare. There's Part A, there's Part B, there's C and D, supplemental insurance, Medicare Advantage. I am completely befuddled. It's almost like it's designed to confuse you and to make you make a choice that you're going to regret later on. There's no system should be created like that. I mean,
And
if I'm not,
if it is set up to confuse you, I mean, there are so many people out there language barriers, lack of understanding, mental health issues. As you become older, there's so many other problems that you end up having. I can't imagine, because it causes fear then. And many of them may be delayed in applying, and they don't have the wherewithal or contacts to have somebody help them with it. So,
Oh, absolutely. They're late in applying, or they sign up for the wrong plan, one that doesn't meet their needs or doesn't include their doctors currently. I mean, one that makes them pay too much out of pocket. All kinds of things could go wrong.
yes,
We shouldn't present things like that to people and say, hey, you're on your own, figure it out. It's not right.
right, right. And with that, let's talk a little bit about, I'm going to call it the big bill that was introduced that had so much legislation in there. And I think I shared with you a long time ago, I worked for a governor here. So I was somewhat involved when I was going through school. I worked for a governor here. And so I understand legislation and writing it and everything else, and how complicated it is, right? So we've got this bill that has so many line items in it, but specifically, I'd like to talk a little bit about the impact that it will have on healthcare. And what's interesting to me is that it's an impact that may not be understood by the majority of the public, but it's also very long term. So it rolls out, right? It rolls out. It has an impact on individuals. We'll talk a little bit about that. It will greatly impact the states, and it seems so complicated that it adds. We're talking about complications now with enrolling and etc. And it seems to add all these layers of complication. So, from your perspective, with the organization that you're in, what do you see as some of the major issues of impact? And if we could time it kind of in line items of maybe 2 years at a time, because I think what most people don't understand it is we have this legislation that passed. Oh, it's done. I don't feel any effect. Nothing's changed. But what's coming down the pipeline?
Yeah, so it's a complicated bill. You're right. There's all kinds of things happening at different times. We're still trying to figure out what's in it. Um, it was so chaotic when they were drafting it because the president said he wanted it by July 4th on his desk, which he
Mhm.
got. But there was so much chaos in the negotiations and pressure. There are literally pieces of it that we can't figure out or that are just contradictory to one another. It's not the way you go about remaking the biggest industry in your country, to be honest. So, the things that happen in the near term, the one that's the biggest one, and it's probably one of the biggest things in the bill, is work requirements for Medicaid. So this is a part of the bill that says if you're, an adult, not over 65, not a pregnant woman, don't have small kids, then you are expected to have work 80 hours a month minimum to get Medicaid. It also, you might be exempt from that if you're a student, if you're a caregiver, if you have, if you're frail medically, behavioral health issues. But for the most part, it's a work requirement. This is going to be enormous. This is the biggest thing in the bill. It's going to lead to about 7 million people just by itself losing healthcare coverage over the next few years.
7 million
7
people?
million just by
Wow.
itself. That's a conservative estimate. I
Yeah.
think it might be higher, but that's just my own speculation.
Okay.
And what it is that, it's what it's trying to say is, well, to be deserving, you should work. We've always heard that in America over the years, But what it really is, it's just putting an obstacle between people and coverage. And we know this. This is not news because Georgia did this in the last few years. It sounds like you've heard of it, state of Georgia.
Yes, of course.
They put in work requirements for Medicaid for about 200,000 people who they were trying to get on Medicaid, but they had to show they were working. The state figured, well, maybe we'll get 100,000 of them. After 2 years and spending hundreds of millions of dollars, they've enrolled 8,000 people.
Wow. It
The
just did.
process is so cumbersome. You've
Hmm.
got to develop call centers and insurance, portals and websites. You have to verify somebody's employed. So now you're gonna have to build a whole computer system so that, the state Medicaid office can check on and verify whether or not Arabelle is working and on the payroll at Chic Innovator, or
Because
whatever.
just to clarify for people that are listening to this, because a lot of people think in terms of, well, it's a federal mandate, if you will, right? So you've got, it's coming from the feds, but it's the states that have to implement it. And the initial implementation begins in 2 years, right?
Right, right.
And people like you, organizations like you, are still trying to decipher it. And yet the states have to not only decipher it and understand it, but get ready all these elements, prepare these so that they're able to function correctly. And then the biggest thing for me is communicating something that they don't understand.
Absolutely. So I want to start right there. So when this also happened in Arkansas when they put in work requirements, and what they found was the main reason people didn't qualify for Medicaid was because they didn't even know there was a work requirement. And they would mail letters to people and text them and email them. Well, people's lives change, they move, they may have other things going on in their life,
You have people that are homeless or that
homeless.
are moving
Yeah,
or that are, in difficult situations, right?
yeah.
And so they may not be reached.
And the and you're right about it being every state's going to do it differently.
Mm-hmm.
Um, but one thing that the law says is that every state must do this for every individual at least every 6 months. And I suspect some more conservative red states are going to want to do this every 3 months.
Right.
This is mind-boggling. Um, and then the bill says for all 50 states and District of Columbia, we're going to give you altogether $200 million to do this. Sounds like a lot of money. Georgia spent that much money alone on
Wait a
food.
minute. For how many? For all the states?
All the states together get $200 million. No, it's
Which
not going to
is
work. Yeah,
that's nothing.
it's nothing. So I can tell you that
Yeah.
California, Illinois, those states, their governors to comply with this law are going to have to put a ton of state money out of their budget, which
Hmm.
goes to schools or healthcare, other stuff, just to build these systems that will probably wind up in blocking people from getting coverage.
Right.
So,
Right.
yeah,
Yeah, they won't be able to. The states may not be able to comply, but then also individuals won't get the information, and they might not even understand the two major parts of what they have to comply with, and may not even hear about it till it's passed.
they
And
won't
then
even know.
are they
What,
precluded if they miss these
they
deadlines?
have 30 days to prove compliance. Prove it,
30
not just
days.
saying it. Yeah.
Yes.
So, and let's be clear about something here. When you look at the people who would be subject to these work requirements, and people have done lots of surveys of this, about two-thirds of them are actually working
Hmm.
already.
Okay.
A lot are in school. A lot are caregivers of elderly parents or somebody else. Some are volunteers, which can give you an exemption. You're really talking about maybe only 10 or 20% of these Medicaid recipients are not working and not doing any of these other things. So that's a small group, first of all. They're going to wind up throwing the rest of them off Medicaid anyway because they're not going to be able to prove it.
Mm-hmm.
And the other thing you find is when you look at the person who's really not working on Medicaid, who, I guess is the one you're trying to incentivize here, it's interesting. It tends to be a middle-aged woman, usually single, who raised children by herself, often took care of her parents,
Mm-hmm.
has been out of the workforce for years, not a ton of education, some chronic diseases. Getting that person back in the workforce is hard, regardless. And taking away their health care is not going to make that any easier.
Right.
We should be facilitating her reentry into the workforce with training, with support programs, because she wants to work, but she just doesn't have the skills, and she hasn't been in the workforce for 20 years maybe.
Hmm.
That's the kind of person we're going to take their Medicaid away from. What good is that going to do? Zero.
Well, that's a large percentage of the population, but apart from that, I mean, when I'm looking at it from a corporate business point of view, people should understand that that individual that you just um, identified is the individual that makes about 80% of the purchasing decisions in this country.
True.
And so if they don't have health care, they're going to have a lot less money. They're going to be sick. They're going to get ill, like we were saying, because they don't have a resource. Or if they get really sick, a lot of that money is going to come out of their pocket, and so that's going to affect their purchasing power. So that will also affect the economy in a big way. I mean, if people want to look at it from a very practical point of view, then that's something that they should be thinking of. Tell me what else. Like, why else should people care? What about if they don't fall within that?
Yeah,
You know,
yeah, that's an important point, and I think for the people who are listening here, I want you to to really think about this for a second. Because of this law, we're going to take $1 trillion. I'm talking about $1 trillion out of our healthcare system, out of our economy, and that money is going to tax cuts for a small group of people. That's I'm not making that up. Just look at
mhm,
the bill. It's a tax cut bill first and foremost, and they paid for those tax cuts in two ways. One, increasing the deficit dramatically, and then going beyond that and cutting Medicaid by $1 trillion over 10 years.
mhm,
That is going to affect every aspect of the healthcare system. If you live in rural America, or if you live in, South Los Angeles, or many other cities in America, in Chicago, wherever, um, you're going to see trauma centers closing, which all of you depend upon, all of we depend upon. You're going to see clinics closing in communities, rural and urban alike. You're going to see fewer health professionals being trained because they're trained in these healthcare settings. You're going to see a big contraction of healthcare access. It's also going to get a lot more expensive
mhm.
because I know, and I talk to hospitals every day, they are preparing for a surge of new uninsured patients into the emergency rooms. That's
Right,
their expectation.
right. Yeah.
Um, and they're going to try to figure out, how do I charge some patients more? And I don't blame them, so that I can take care of these people who have nothing. Because right now, I'm not going to be able to meet payroll. And this is going to affect the hospitals who are most vulnerable to begin with, who are treating low income communities, who are, treating lots of Medicaid patients, don't have a lot of philanthropy, or, aren't rich places. But it's going to affect everybody
And it'll affect the large hospitals as well, right?
across the board.
Across the board. So it's not just in the poorest areas of the country that this will be affected, but it'll be across the board. And so even some of the bigger hospitals, because again, you're going to see more in their emergency room. You're going to have to somehow they're going to have to cover the costs, and so it'll increase for those that have to pay. Insurance is surely going to go up. The ones that do pay are able to get insurance and cover their own insurance. It almost has to go up because the cost is going up of medical attention, if you will, and the training. I'm curious. You mentioned about the training, so tell me
Yeah.
a
So,
bit about.
I think one thing that gets lost in this conversation is that the healthcare system, it kind of replaced manufacturing as the biggest thing in the country.
Mm,
And it trains not just doctors, it trains nurses, respiratory therapists, nurses aides, LPNs, on and on and on. And Arabelle, I go all over the country every week, and I'm in, Spartanburg, South Carolina, or New Orleans, or LA, or wherever, Columbus, Ohio, or Cleveland. Almost all those places, the part of the economy that is most critical for people to have good middle class jobs with benefits is healthcare,
Mhm.
and it's usually hospitals. So this system has been a pipeline to the middle class for many people. A lot of our hospitals have training programs to help defray the cost of training for free. Often
Mhm.
because they need people to work there, and
Mhm.
they wanted to make that investment. So the biggest problem with the big beautiful bill, um, it shuts off the escalator.
Yeah.
It pulls the ladder up, and I think as the economy gets weaker now, and we're seeing it, this bill is going to make things worse. You're going to see disinvestment from our communities. It is disinvestment from our communities, and it's going to have huge economic impacts. So it's tough. It's real tough, and and again, it's red states as well as blue states are going to feel this. Rural areas, I think, are going to feel it in some ways the worst
Even
because
worse. Right.
they're already on life support. Yeah,
Right.
yeah,
Right. Right. I mean, it's been tough already, right? But it'll get even more tough. And the truth is, those that are interested in the medical industry, if they can't get trained, or if in the long run they can't get paid, they're going to have to go where they feel they can be more of service also, and can, um, exude a profession, right? That they long for and that they've looked for. So what can people do? Because again, this spreads over 10 years,
right.
right? It's again, we're going to start seeing most of the initial impact within 2 years, and then it spreads over 10 years. So can people do nothing now? Like, what can
Um,
people do?
no, they can do some things now. So the first things are the work requirements kick in January 1st of 2027. That's coming up pretty quickly.
Mm-hmm.
These
Mm-hmm.
states are not going to be ready for that, no matter what anybody says.
Mm-hmm.
That's just it's just bull if you think you're going to be ready for that, for this undertaking that's so large. I think it's important to know that nothing like this is set in stone. This can be undone. It can be changed. It can be partially repealed. It can be amended. All those things can happen. That'll depend on who's in power and everything else.
Mm-hmm.
But that's a real possibility, and people know that. And some of the things in the bill take place later, like after the midterm elections. No surprise, because
Mm-hmm.
politicians don't want to deal with the consequences before the midterm election. You've probably seen that before. Um,
Yes. We have.
so we have a little bit of time. I think it's going to be important for people, regardless of their politics, to educate themselves on what's happening, like you're doing today, but also to make it clear to elected officials, I'm going to hold you accountable for this. When the time comes, when the opportunity presents itself, you say you're for healthcare, I'm going to expect you to act, and I'm going to watch. Just talking about it may sound, okay, but at some point, I'm going to expect you, my congressman or my senator, especially if you are in a position to change this, to change it.
Mm-hmm.
Do this, not just talk about how bad it is. And that's going to take some trade-offs also. It might do some things like, say, fewer tax cuts. It might mean some trade-offs, but that's what I think people have to sort of be prepared for and to get us ready. Because if we're silent and don't make that accountability clear, things won't get done.
Right. No, and I think the thing is, a lot of people just don't understand.
Yeah.
They don't understand it. Again, it was so big, that they didn't understand it. And so I think asking the questions, where would you suggest that they go? I mean, to get a better understanding. Obviously, we're going to share the information you're giving us here, but for somebody, who wants to go to their congressman, as they should, or their U.S. senator, and um, where do they go to be prepared with their maybe key talking points?
There are good, neutral resources out there. at places like the Kaiser Family Foundation, Commonwealth Fund, our website, although we're not considered neutral, we are advocates for hospitals, to be clear. But there are places like that are, think tank places where these things are talked about. And I would say the Kaiser Family Foundation, the Commonwealth Fund, they're nonpartisan, but they'll be truthful. This is $1 trillion taken away from healthcare. This is at least 11, probably closer to 17 million people losing coverage, and everyone spending more and getting less. That's what it is. And
Mm-hmm.
if you take that away from it, I think that's wonderful. But they should get that information and understand it. And they're going to start to see this. They're going to start to see it when the clinic closes down the street. When the hospital lays people off and says we have to reduce hours. When the rural hospital closes in their community, they will see it, and they need to understand this is a direct impact of this law that was passed. I say that because there will be many attempts to muddy the waters and to say, well, that hospital didn't close for that reason. I know that when rural hospitals were closing in America over the last 10 years, many people in those communities, when they were asked about it, responded, that was due to Obamacare. Obamacare closed my hospital. That wasn't true. Obamacare actually helped to keep it open longer than it would have been. And it also gave people insurance who wouldn't have had it. But there's going to be that kind of misinformation out there, and people need to be protected to see that and against that.
And I think they need to start right away. I mean, again, we have such a short time span.
Well, they're going to, yeah. Well, I'll give you even a shorter time span because this is something we haven't talked about. The other thing that I was going to mention, so during the pandemic, the United States, the Congress voted to increase the amount of money that goes into the healthcare insurance exchanges, the ACA exchanges, which are for people who make too much money to be on Medicaid, but to get them affordable insurance. And there's lots of people, millions around the country who are on these exchanges. Sometimes it's called the marketplace, other things.
Mm-hmm.
This is a technical term, enhanced premium tax credits expire at the end of this year.
Mm.
So unless Congress acts, and we're not sure they will, I would say they probably won't, this Congress, 6 million people will lose coverage next year because their premiums will skyrocket. There are people, for instance, in West Virginia who are on the exchanges, middle-class people buying low-cost insurance who are going to see their premiums jump $2,000 per year next year. So you're going to start to see that also.
I mean, that's so much money.
It's the end of the game for most
yes.
people.
Yeah. Some people are living paycheck to paycheck and don't have any room, and $2,000 just in that. Plus, everything else is going up, right? Grocery bills, everything else has gone up. So.
Thank you. I mean, with job growth apparently stalled,
mm-hmm.
And bills going up, and then people starting to lose coverage as soon as next year, I think there's going to be a real conversation in this country about how do I get my health care and how do I get it back? Because, like we said before, if you don't have health care, a lot of other things you don't have, like economic security and maybe even a job. So the ripple effects will be huge.
No, and I think a lot of people don't realize, or maybe they do, but this economy has changed. A lot of people don't have full-time jobs. Yes. And so it's not like they can get insurance through their employer. We give insurance to our employees, but that's going to go up. Mm-hmm. My cost is going to go up. Corporate America, their cost is going to go up for the insurance. But there's a lot of people now, especially after COVID, that are doing freelance work. The economy has changed. It's a lot of part-time work. And so they have to get their own insurance. And if they can't get it, they get sick, and then, again, it rolls, and then everything else that we've discussed increases. But the economy has changed. the workforce has changed. And
Right.
yeah.
Yeah. Which is, that's why I say we need to cover everybody.
Hmm.
Because with that kind of an economy, you can't rely upon it to give people coverage to their jobs. That's kind of over for most people. You got to find some different way to make sure they're in the tent no matter what.
Hmm.
And it's interesting. One of the effects of the Affordable Care Act in the early years, when it really did some good and people got coverage, is many more Americans started small businesses, which is considered
Right.
positive
Right.
because they had coverage. They had low cost coverage back then.
Right.
Yeah.
Right.
And they had the flexibility to like, hey, I can leave this part-time job or lousy job,
Hmm.
have coverage, and do something that is good for the whole country.
Hmm. Hmm.
Start a small business.
Yeah, and I think really our legislators, or legislature on a state basis, local basis, and especially on a federal basis, they have to look at this country and the new economy. It's a new economy. It's not the same, especially after COVID.
No,
It's all changed.
yeah, and you have to, I think, protect people in that new economy to some extent.
Hmm.
You know,
Hmm.
as opposed to be, sorry, you're on your own. You're a gig worker, and we can't help you.
Yeah, because the truth is, we don't, we don't live in a bubble, and you're going to have to interact with people out there in public. If it's at the grocery store, if it's even walking down the street, if it's at an event that you go to, and if a lot of people are sick because they're not getting health care, you're going to be affected.
Yep.
Your kids are going to be affected in school. It's not like you're isolated and living in a bubble. That's so I think, you know, people have to stop thinking in a selfish way because the truth is that we're all interconnected. So, and I want to thank you, for all the work that you've done. Again, I mentioned at the beginning that you're going to be leaving the organization this year. I have a question though, because while the incredible things that you've done in healthcare, um, if you could name maybe for me one or two of the things that you are most proud of, and how do you measure, what you are most proud of?
Wow. Years and years ago, I worked in public health before I worked in hospitals and stuff. And I worked in the health department back in New Jersey. And I was really proud back then because we did some things like really dramatically reduce lead poisoning in the state.
Mm,
I was really proud of that. And New Jersey, probably like Illinois, has a lot of older homes with lead paint.
yes. Yes.
And it's a huge issue. And now we know lead pipes also. And we made a big difference there. And that has a lifelong impact on children.
Sure does. Yeah.
Massive. So I was
Yes.
really proud of that. Um, and then, later on, when I worked in New York, I worked in the public hospital system. 8 out of 10 children in New York use one of our clinics.
Oh,
And I was just proud. That just made me feel good every day.
eight
You know,
out of 10.
eight out
That's
of 10
huge.
in New York use one of the New York City public clinics, public hospital system clinics.
Mm-hmm.
Primary care, sometimes special. They get everything they need. It's not
Mm-hmm.
always perfect,
Mm-hmm.
but it's a great system, and it really provides access, especially access to communities of immigrants, access to communities of native-born people, without regard. And I was very proud that we were able to do that.
That's a
And
huge number. That's
oh
a huge
yeah,
number.
yeah,
Well, congratulations on that, and thank goodness that there's a system like that that people are able to use, to stay healthy. So,
it's a great system. It really is. Yeah,
yes, no, thank you. And thank you for taking the time. I know you're so, so busy and doing so many things. And so, for our Chic Innovator audience, and I've got to tell you, it's a very smart group of people that listen to us, and they send in all these questions. And then I run into people all over. And again, we have an audience not just here in Chicago. We have New York, we have some people in Washington, San Diego, et cetera, et cetera. Because we also have a lot of influencers that follow us. But if you were to leave a message for our audience, based on like the discussion that we had, what message would you give them?
pay attention. There's a
Okay.
lot of things going on right now. in a lot of places, including in healthcare. Some of it's just noise. Stick to the real facts. In our instance, $1 trillion out of healthcare, out of Medicaid, into tax cuts, at least 11 million people losing health insurance. Those are facts.
Those are facts, and it's important to understand them and to know them.
No, yeah.
And to understand we have a voice. So, utilize it, right?
I mean, yeah. And the other thing I should mention, I'm not chic. I want to be clear about that.
I look pretty
But
chic at the event.
yeah,
Yeah.
given the passing of Giorgio Armani, I am wearing Armani today.
There you go.
Emporio Armani, not the fancy stuff. Entry level, but it feels good.
Well, you always look great. And again, you and your wife are invited. Runway Latinx, October 18th here in Chicago. Let me know if by chance you'll be in town. I think you would really enjoy it. And it goes for a good cause. As I mentioned to you, we'll be giving out scholarships to several young women this year that are already in school and college level age. And, we're excited about it. Yeah.
Thank you for doing that. I mean, I think it's great that you do this and get the word out, but I also think it's great that you're actually, helping individuals and helping, blaze a path for them and ease that path.
Yes. I think, we're all trying to, I think people should try to do the best that they can. I mean, I think that's what makes life worth living, right? It's not just about doing well in your career, but how is your life impacting somebody else in a positive way? And thank you so much because you're impacting so many lives in such a positive way. So really appreciate that.
Appreciate the ability to sort of tell our story here. Thank you.
Yes, yes. No, and stay in touch. Stay in touch.
Will do.
All right. Thank you. Thanks so
All right.
much.
Take care. Bye bye.
Bye. Bye.